Hello everyone, welcome back to my channel. This is Dr. Zina speaking. Today we were talking about the unilateral chewing, or in other words, chewing on one side or eating food in one side only, either the right or left side. Is it good to chew like that or not good? We will all discuss about it and make sure to watch the video until the end in order to understand more. And please make sure to follow. Let's start now. Many people have the habit of chewing on one side of the mouth. Unfortunately, this what happens? It will place a pressure and tension on your temporomandibular joint and the muscles that surround your TMJ. As a result, people who already have TMJ disorder who frequently chew on one side may experience an increased joint dysfunction and pain at the end. So here is a picture showing a person who is biting or chewing on one side, how it creates uneven pressure on the right side compared to the left side, which will result with time, if this condition persists, co- chewing on one side, it will result in TMJ disorder. What do I mean by TMJ disorder? I mean that you will have pain whenever you open or close your mouth. And you will not only have this, you will have discomfort. Not only that, clicking sounds. Whenever you open and close your mouth, you will have clicking sound. All this are the symptoms or the signs of TMJ disorder. So make sure if you are biting in one side only, it's not good to bite like that. You need to bite on both sides better than biting on one side only. Here is a patient who did not know about the this habit, the one side or unilateral chewing habit. That this condition it's not good to do like that, or this habit is not good to do like that. Then what it ended that, as you can see in the picture before, that his mandible deviated toward the right side compared, so you can see his midline has shifted from being mid center into deviation toward the right side. This is all due to the unilateral chewing habit. So not only discomfort and pain and clicking sound, you will also have deviation toward the affected side where you are chewing. So this patient, he used to chew unilateral chewing on his left side more compared to his right side, which ended to deviation toward the left side. And because of that, the only treatment that has to be done to the patient in order to correct this deviation is jaw surgery. Jaw surgery was performed on this patient in order to correct this deviation. Now, some people might tell me that I am chewing on one side because I have missing teeth on the opposing side. Maybe, or I am having a tooth decay. I am having pain. I cannot bite on the other side. I have a broken tooth. So whenever I bite, I feel pain. So I try to avoid biting on the side where I have pain. Or he might say that I have loose teeth. That's why I am biting on one side only. Anyways, these reasons can be resolved once you go to a dentist. These are simple things. But make sure once you solve these problems, missing teeth like denture or tooth decay, going to a dentist and fixing the tooth decay, broken teeth, loose teeth, going to a dentist and fixing the problem. Make sure after you are done with this, you need to train yourself gradually to avoid unilateral chewing. You need to chew on both sides. Otherwise, it will become a habit of yours and you start ignoring the both side, you will only chew on one side, and that is not good habit. So you need to train yourself gradually. And I will show you a video in a couple of seconds. If you are having this habit, you need to do this exercise in order to uh, return back to your old habits before chewing on both sides rather than unilateral chewing. So, what is the disadvantage associated with chewing on one side? The chewing on one side will make the temporomandibular joint gradually and unevenly worn on both sides if this condition persists for many years. Now, your TMJ will tell you why is there, like for instance, there's a patient who is by or is chewing on one side, which is the right side, and he's ignoring the left side. Now your TMJ from the left side will say, why I am still here if the patient is ignoring me? I should ignore him just like how he ignores me, because you know that your TMJ is V shape, it's V from the mandible, or you can just from the chin up to your ears. It is V shape. They are connected together, right and left side. So if one side is ignored, okay, with time it will gradually worn away and you'll end up having a TMJ disorder. So because your TMJ will tell you that why I am still here if the patient himself is ignoring me.
Are you chewing your food more or just exclusively on one side? Well, here's why that's a problem. The jaw is one bone and two joints, and in order to have a healthily functioning jaw, we want to have both sides working evenly. So the simple strengthening exercise is geared to strengthen the side that you're not chewing on. Note that if you are not chewing on a particular side because it causes you pain, then this exercise is not for you. So what you want to do is grab a popsicle stick, and you're going to take this popsicle stick and put it on your back teeth. Then what you're going to do is you're gently, with 15 to 20% of the strength of your jaw, you're just going to bite down on the popsicle stick for 10 seconds. Here's what it looks like. And relax, and again. There you go. Super easy, super simple. Also, are you chewing your food more or just exclusively on one side? Well, here's why that's a problem.
Thank you all for watching my video. If you have any questions, please do write it down in the comment section below, and I will be more than delighted to answer your questions. Goodbye now.